saying this from as far back as 2010, and I was accused by some for hating the private health sector. When I said all I'm looking for is justice for people, is affordability for the citizens, I even said it is a form of uncontrolled commercialism as described by the World Health Report of 2008. So I was absolutely not surprised. I've been knowing it. All I wanted was for the public and the citizens also to know it so that we resolve it. But also, Elvis, I wasn't surprised. This was also picked up by the National Development Plan. Remember, the National Development Plan of the country, Vision 2030, said there are two problems with the healthcare system in South Africa must solve. The first one are the exorbitant cost of private healthcare, and the second are the problems of efficiency and quality in the public healthcare system. So nothing is really surprising me.
Mm-hmm. Now, what are the reasons given to you by the private healthcare sector for these increasing prices?
Well, they are giving reasons of their own, which is why there is a commission, Elvis. Chief Justice Ngobo is trying to sift through all this. Everybody is presenting evidence in the form of tables, in the form of graphs, in the form of numbers and statements and codes. The Chief Justice with the four other commissioners have got to sift through this to come to a conclusion as to why. I've got my own reasons, Elvis. I'm presenting them tomorrow to the judge, to the commission. The private hospitals are presenting theirs starting from this morning. They are trying to give their reasons. And so I will also present in the reasons. But in my own thinking, it's just exorbitant cost of what private hospitals are leaving to the public.
Mm-hmm. Now, what is the solution, Minister? Is it the NHI that we're talking about, or is there more to that meets the eye, though?
Absolutely, absolutely. The solution is a universal health coverage. And remember, Elvis, it's not only us who are dreaming about this solution. On the 17th of February, when the World Health Organization and the OECD, Organization for Economic Cooperation and Development from Europe, when they were presenting, the judge asked them about the solution. And they pointed out that we need universal health coverage. And the United Nations also said the same thing. That's why the question of universal health coverage is one of the 17 Sustainable Development Goals. And as you know, in South Africa, universal health coverage, we call it NHI. And we believe that is the solution to all these problems.
Now, how receptive is the private healthcare sector to your intervention in regulating price increases?
The medical schemes are ecstatic about it. The private hospitals are arrogant against it. I mean, the medical schemes believe there must be regulation. They are very watching. They even wrote me a letter, Elvis. The BHF, or Board of Healthcare Funders, which represent 80% of the medical schemes of the country, wrote me a letter as far as 2010, an SOS letter, and say, Minister, please come and help. We are bleeding here. Do some form of regulation. They were pointing to the fact that in 2002, South Africa had 141 medical aid schemes. Now, today, we have got only 83. They are falling apart because they also cannot afford the prices. So they are calling for regulation, but the private hospitals, which are in the pound seat and getting all the money and leaving all this exorbitant cost, are saying no. So it's a fight. It depends who is getting something. But I can tell you, on this one of regulations, the private hospital don't want to hear none of any of it.
Now, Minister, how long will it take for the National Health Insurance to reverse the current situation?
We gave ourselves 14 years, Elvis. We have got to work very hard because, as we said in paragraph 2 of the white paper of National Health Insurance, we said this is a significant policy shift. It will necessitate a massive, I want you to underline the word massive, it will necessitate a massive reorganization of the healthcare system, both public and private. Now, to massively reorganize the healthcare system is going to be a mammoth of a task, and we gave ourselves 14 years with the hope that by that time we'll have made very significant changes.
And the beneficiaries of the NHI, Minister, who will it be?
It's the whole population. Elvis, because let me define what NHI is. It's a healthcare financing system that pools funds for the whole population in order to give access to good quality healthcare. Now, that definition, if you listen to it, is exactly what medical aids are doing. But there are two main exceptions, very big exceptions, that medical aid scheme are pulling funds for only 16% of the population at very exorbitant cost, but for only 16% of the population. The word all, that means the rest of the citizens, or the word universal doesn't apply. Secondly, within medical aid, they are still stratified socio-economically. Even if we have got medical aid, Elvis, some have got much better, others have got lower end medical scheme where they are told your medical scheme can make you get this treatment. The other is told, no, your medical scheme can't give you this type of treatment. So in NHI, we have got to solve all those problems. That's why the word universal applies.
Now, I can tell you we invited the Hospital Association of South Africa, also known as HASA, to participate in this program this morning, but they told us that they was not available today. Now, HASA, for those of you that don't know, is the umbrella body of privately owned hospitals here in South Africa. 95% of South Africa's private hospitals fall under the HASA umbrella. We also have to tell you that the inquiry into the high cost of private healthcare here in South Africa is underway right now in Cape Town.